Let us review the method of taking a sample using a syringe and blood transfer unit, or BTU. First, gently squeeze the reservoir plunger flexures together. Smoothly and evenly pull up on the reservoir plunger until the plunger stops and the reservoir has reached its 5 cc volume capacity. Once the clearing sample has been drawn, close the reservoir shutoff valve by turning the handle perpendicular to the tubing. This will further ensure that the sample drawn is from the patient and not the reservoir. Swab the Vamp needleless sampling site with disinfectant, such as alcohol or other antiseptic, depending upon hospital policy. Next, obtain an individually packaged Vamp needleless cannula and lure tip syringe. Using aseptic technique, peel open the cannula pouch. Pick up the cannula by the protective shield. Attach the cannula onto a selected lure tip syringe by aligning the cannula lure lock to the lure tip on the syringe and twisting until secure. Ensure that the syringe plunger is depressed to the bottom of the syringe barrel. Push the cannula into the Vamp needleless sampling site and then draw the required volume of blood into the syringe for sampling. Note: do not use a hypodermic needle through the sampling site. To remove the syringe cannula assembly from the sampling site, grasp the cannula and pull it straight out. Once the last sample has been drawn, open the shutoff valve by turning the handle 90 degrees so that it is parallel to the tubing. Smoothly and evenly push down a plunger until the flexures lock in place in the fully closed position and all fluid has been reinfused into the line. The recommended time to push the reservoir plunger to the fully closed position is 3 to 5 seconds. The clearing sample should not remain in the reservoir for longer than 3 minutes. Flush the line clear and swab the sampling site, ensuring removal of any